Welcome to today's episode of Face Facts by Dr Yusra. On today's episode of the podcast, we have spoken to child and adolescent psychiatrist Dr Hassan Yasin. We've spoken about ADHD in both children and adults, and we've touched on the types of symptoms that may present in childhood or in adulthood, what to do if you think that your child or you might have ADHD, and what treatments may be available to help support you in a diagnosis and ultimately in lifelong success. I hope this is helpful, and if you have any questions, please don't hesitate to leave a comment below. Enjoy. Hi everyone, welcome to today's podcast. So on today's podcast, I have Dr. Hassan Yasin, child and adolescent psychiatrist, also happens to be my husband, and is on the advisory board for the Dr. Yusra Clinic, and supports us with ensuring that we're supporting our patients' psychological well-being. He's also the founder of Aesthetic Mental Health and has formulated specific tools to help assess patients' psychological well-being and appearance anxiety, which can help support clinicians in their diagnosis and management of aesthetic patients. But today we are here to talk about one of the things that keeps you really busy, which is ADHD.
Mm-hmm.
So I have a lot of patients, a lot of colleagues, have seen lots of children who are being diagnosed with ADHD. I find it's almost becoming a little bit trendy. I know that I've asked you if I have ADHD in the past. So I want to know, tell us a little bit about ADHD. What is it?
ADHD is a disorder of attention and hyperactivity.
Mm-hmm.
It could be either of those or both of those,
Mm-hmm.
where a individual might struggle with focus and concentration
Mm-hmm.
to the extent that it actually impacts the level of function on a day-to-day basis
Mm-hmm.
in multiple domains of their life, and or hyperactivity, which people often think is, kind of running around, but it doesn't necessarily mean that. It can just mean doing a lot of things and, going from thing to thing,
Mm-hmm.
and not being able to be still.
Mm-hmm.
So ADHD can be a combined type with hyperactivity and inattention, or could be one or either of the other.
So how does it differ from ADD?
So ADD would be
attention deficit disorder.
So without the hyperactivity.
Ah, right.
Mm-hmm.
Okay, cool. And is this something that you develop, or is this something that you're born with?
That's a very good question. So it is a neurodevelopmental disorder,
Mm-hmm.
which means that it is part of the brain's development, and obviously brains develop all the way up to the age of between 25 and 30. So, a young brain in the womb doesn't stop developing only in the womb, and there are other elements to, kind of with the brain development once you're born. So it is a neurodevelopmental disorder that can continue through from birth onwards.
So is it both nurture and nature, or?
Definitely, there's a huge element of nature.
Mm-hmm.
So there's a huge genetic component to ADHD, and that's very, very clear. But there seems to be increasingly a lot of evidence about the evidence of nurture as well.
Mm-hmm.
And a lot of the interventions that we might put in place would be things like parenting and structure around the child that seems to improve symptoms in a lot of children.
So I know that you're really passionate about talking about even kind of pregnancy, and I'm reading a book that you told me to read recently, which is called the book you wish your parents, what's it called? The book you wish your parents had read.
Yeah, and your kids would be glad.
That you did. And it has a whole section on pregnancy, which I skipped because I thought, well, I'm done with my pregnancies, but I wish I had read, before I had my children. So I strongly recommend that. I know you recommend that to lots of people. And it talks about how neurodevelopmental kind of impacts happen from when the baby is in situ, even stress, even chocolates. Like I read a research paper talking about how eating chocolate during pregnancy and that feeling of happiness and dopamine release in a mother can positively impact the baby's brain later on in life. So I'm not saying eat chocolate before, this is miscontextualized, but yeah, it's really, really interesting. So I know you're a child and adolescent psychiatrist, but you also deal with adults, and you're doing a lot of adult assessments. Is this something that I'm hearing more and more about it now? And more adults are being diagnosed with it, 30s, 40s, even in their 50s.
Mm-hmm.
So is that, is there an overdiagnosis happening, or is there a greater awareness? Is it something that people have likely had their whole lives? Do they need a diagnosis? I mean, so many questions at once, but what's going on there?
It's likely a bit of both. So there may well be an overdiagnosis, but that is coming from a raised awareness in the general public about the fact that there is a condition called ADHD and that it affects, up to 5% of the population, maybe more. So, in children, 5 to 7% of children will be diagnosed with ADHD. In adults, it's a little bit less, between 2.5% to 5% or so, but that's, increasing now. So there is more of an awareness around it. But you've also got to bear in mind that those people in their 30s and 40s, when they were kids, that really wasn't a diagnosis that was given. And so now that that diagnosis is more widely accepted and understood, people are turning and saying, well, actually, maybe that does explain some of the difficulties that I've had throughout my life. Because it wouldn't be something that someone's developed in adulthood. It would be something that they've had since childhood. And the way that it presents may have morphed over time. But it would be something that they kind of say, well, this might well explain why I've struggled with, not getting the jobs that I wanted, or consistently handing in things late, or consistently, kind of not being able to focus in the way that I want to on tasks that I know are important, but I still can't focus on them.
Okay, so let's talk about that. So in childhood, how would that manifest? And at what age would it manifest? Like every neurodevelopmental disorder, there's a range of and a scale of how people may present. In children, often you'll find that the hyperactivity and inattention present together a lot of the time, especially in boys. In girls who have historically been kind of less diagnosed with ADHD, it may well be because girls are better at masking things and holding things together in school, and may struggle more with the inattention side rather than the hyperactivity side. And that presents itself in a less disruptive way in school. For girls?
Yeah, it can do. Yeah. Oh, that's some of the thinking now about why girls have historically had fewer diagnoses than boys. But a young child with ADHD will present with inattention. So they'll struggle a lot with paying attention to and focusing for a long period of time on tasks. They may struggle with jumping from task to task, may have to receive instructions several times to get a task done. If it's a multi-level task where it requires 2 or 3 steps in a row, that might be completely overwhelming. And then the hyperactivity and impulsivity would mean that they don't have the inhibition to stop themselves from doing things that might be risky or disruptive. And so that's obviously something that gets highlighted in classrooms.
And is a diagnosis helpful or is it limiting?
I would say it's extremely helpful for the majority of people that get diagnosed. So with a so we'll come on to this later, but obviously an ADHD diagnosis isn't always negative. So there's a lot of qualities that ADHD people with ADHD have that we can talk about as well, where actually a lot of people think ADHD is their superpower.
Yes.
And so it certainly isn't something that I would say is scary or is negative in its own right. And it's a descriptive term for a series of things that you might struggle with. So it doesn't mean anything in its own right just because you've had that label, but it might help you understand why your child or you yourself might struggle with certain elements in your life that have always felt like they shouldn't be a thing that you struggle with, but you do. So for children, for sure, that get diagnosed, even without a treatment, and again, we can talk about that in a moment, but even without that, just accommodations at school, having extra support, maybe having a less stimulating environment, having extra time in exams, having a task broken down into bite-sized chunks rather than a big task. All of that might kind of transform a child from going just meandering along to actually excelling and doing really well. So I would say if there's a query or a question, then getting it checked is likely to be more positive than a negative.
Because I see a lot of mothers who may have children who are struggling to concentrate at school and maybe falling behind, whose teachers have brought up concerns regarding their development, but are concerned and resistant to receiving a diagnosis because they are concerned that might limit them in later life. or that they might identify as having a problem, so to speak. It's almost like a label.
Sure.
And they don't want that label. And so are, trying to push back on it. But in your opinion and in your experience, actually having a proper assessment and a diagnosis where appropriate means that the school can create changes that can support the development of the child so that actually they thrive, not just survive that period of their time.
Yeah, absolutely. I think, just a label on its own probably isn't helpful. So if we, someone were to come in and we said, you have ADHD, good luck. I'm not sure how helpful that is, but for sure, if it's, first of all, the assessment needs to be thorough and, kind of there's multifaceted elements to how you do the assessment. But as long as the assessment's thorough and ADHD can be very accurately diagnosed, then reasonable adjustments can be made. Parents can have interventions like going on parenting courses and understanding their role in the management of a child with ADHD, and that can be very effective too. So even without thinking about medications, that can be a very effective change that can happen in a child's life, going from people not really understanding why the child's behaving how they are to actually adjusting and putting in steps and adjustments to help the child thrive.
So in terms of, sorry, were you about to say something?
And then of course there's the medication element too that can also be considered, which, it doesn't work for everybody, but, and depending on the type of medication, there can be more or less likelihood of success. But I've seen patients that come and say, it's like having a different child. It can be that profound. With other patients, less so. As you can imagine, different people respond differently.
Of course.
But it can be life-changing for some people.
I hear that all the time. I was recently in Italy, and two of the people that I was with, my work colleagues, said that they were diagnosed with ADHD and they now take medication. It's transformed their lives because it's allowed them to focus. But some people get very sick with it and can't tolerate it and find that lifestyle changes are better. So in terms of kind of recognizing that you might have ADHD, what are the general signs and symptoms that you might see in your child that would raise a question mark? And if you're an adult, how does that manifest different? So let's talk about children first. So if you had a child, what are the signs and symptoms? You said difficulty concentrating on tasks and potentially also hyperactivity.
Yeah, so it would be either difficulty concentrating, and that would be in more than one domain. So it would be, not just necessarily one subject in school, but if it's in school in general. Although if a child's particularly interested in a topic, there's something called hyperfocus, where it's one of the superpowers of ADHD that a child can actually go into a state of hyperfocus where they're interested in a topic to the point where they can stay on that for potentially hours on end. Sometimes it's not so helpful when the hyperfocus is on gaming, for example, but it can be really, really helpful if it's a topic that they're particularly interested in. But yeah, so you'll find generally that focus is difficult, paying attention is difficult, and so they're easily distractible, can jump from some, kind of wanting to do one thing to want to do something else very easily. And then the hyperactivity and impulsivity would be constantly on the move, wanting to do something, and the impulsivity would be not really having the inhibition to weigh up whether they should or shouldn't do something. They've just not weighed that up, and it's a thought and it's turned into an action without the weighing up. And that translates roughly into adulthood. However, with adults, you find that because of the way that the brain develops, so quick neurology kind of lesson here is the brain has the basal ganglia and the prefrontal cortex are the two main areas, with the cerebellum as well, that are involved in ADHD as far as we understand. And they're involved in things like emotional regulation, impulse control, executive function, and focus and attention. Now, the brain develops, as we mentioned, until the age of 25 to 30. So, so a lot of adults will grow out of certain elements, like maybe the hyperactivity or impulsivity, but the inattention might remain. So they might have been a child that was impulsive and hyperactive, and couldn't focus and couldn't concentrate. But as an adult, less so on the hyperactivity and impulsivity, but they might still have that lack of ability to focus on tasks. And that means that they procrastinate, don't get things started. When a task has a number of elements to it, unless it's broken down into bite-sized chunks, it just seems overwhelming and is put off indefinitely. Yeah.
Okay. So neurologically, what's going on?
So in the brain, the noradrenaline and dopamine, there isn't enough of it in the brain to maintain attention focus, especially in the prefrontal cortex and the basal ganglia, which is why the medication that we would give increases the levels of noradrenaline and dopamine in the brain, which allows for that focus. There are different types of medications. So the stimulant medication would do that. So they would stimulate increased levels of dopamine and noradrenaline in the brain. And then for people that can't tolerate them, because as you mentioned earlier, some people on medication find that they struggle with anxiety. It might make them feel, kind of off, I guess, some people feel, and some people get high blood pressure and increased pulse with it, and so they can't take it for physical health reasons. And for those people, you'd have potentially non-stimulant medication, which more focuses on the noradrenaline and not the dopamine. So when you're looking at how effective they are, people on the stimulant medication, there's a 70 to 80% of people will have a positive response in terms of the symptoms on the stimulant. Whereas with the non-stimulant medication, which is usually tried after the stimulant, or if they can't have the stimulant medication for any reason, the non-stimulant medication, about 50% of people or so might have a positive response. The other things to consider would be the stimulant medication acts very, very quickly. So,
give me an example of stimulant medication.
Methylphenidate, so
Okay.
Concerta.
I see.
Or lisdexamfetamine, so Elvance. Whereas the non-stimulant medication, that works much more slowly. So a stimulant medication might work within the first hour of you taking it, and you might notice a difference in your focus. Whereas
So that increases the amount of neurotransmitter. Is that right? Did I understand that right?
it increases the amount of it blocks the reuptake of noradrenaline and dopamine. So it increases the amount of noradrenaline and dopamine available in the brain.
Got it. Okay, fine. So then that stimulates concentration.
Yes.
And does it stimulate mood? Because dopamine does it? Or is it, no, that's serotonin?
Yeah, not really. So it wouldn't necessarily have a huge impact on, but although emotional regulation or emotional dysregulation can be an element of ADHD, and so you might find that people are able to regulate their emotions a little better on the medication.
Okay, so then the non-stimulant medication does what?
That works on the noradrenaline only, not really on the dopamine. But that takes a number of weeks to work rather than a number of kind of hours. So you might have to take it for 2 to 4 weeks to start seeing an effect on a regular basis. So it's a lot slower, and because it doesn't target the dopamine, not as many people find it as effective.
That's interesting that with ADHD you think of children who are maybe running around and super hyperactive, and then you're giving them a stimulant, but actually it helps them to regulate their behavior, and it's because they don't have enough of the neurotransmitter.
Yeah, so a lot of people think that what ADHD medication is to dull a child down.
Yeah.
But that's actually not what we want to do. The reason a child can't focus is because the brain isn't firing in the right way, and stimulating it to fire in the right way actually helps with focus.
So how do parenting courses help?
Well, parenting courses can be really helpful because the ADHD brain responds very well to certain things and doesn't respond so well to other things. So as we said, there's an issue of dopamine, for example. So a parent that starts to understand how their child responds to consequence and reward can start to fortify that child. A parent that understands how to break down tasks in a way that isn't overwhelming for the child can again start to communicate and get the child to progress in a way that maybe they were finding overwhelming. So parenting courses, and again, a lot of parents feel it's almost an insult to be sent on a parenting course. And I get that a lot. Why would I need to go on a parenting course? I'm not. I'm not
a bad parent.
I'm not a bad parent.
Yeah,
and that's absolutely true. No one would insinuate necessarily that if you're on a parenting course, it's a punitive measure because you're a bad parent.
Yeah,
you're on a parenting course because actually you want to learn the skills that you don't necessarily innately have to manage a child that has a certain set of characteristics that you might have.
To be honest, I mean, I always say there's no manual for parenting, and if there are parenting courses and manuals for parenting, that's a great thing that everyone can benefit from. You know, no matter what child you have, whether
Absolutely.
they have ADHD or anything.
Yep.
And each child is unique in their own right, and you know, you read books and you discuss, and every child is different and requires listening to. And you're not born knowing how to parent. It's a kind of a skill that you acquire. So I think parenting courses are helpful for everyone. It's not punitive. It's
absolutely. And in the same,
but I can see how it might be deemed as, what are you trying to say? Is this my fault?
I mean, that's unfortunately calling them parenting courses. Maybe we just need a rebrand, so they're not called a parenting course, because you know, it isn't identifying a deficit in the parent.
Yeah,
it's identifying that there is just something that we can fortify the parents with in terms of a skill set and understanding of what ADHD is and how to maybe better manage it. Amazing. And that tends to help the children, and I guess the parents as well, and understanding their child. So around half of the people that have parenting courses, you can see a direct impact on the child at home and in school. 50%. Around that. You'd find that you see a direct impact at home and in school in terms of the behaviour, in terms of academic performance, and in terms of being able to follow through with tasks and so on. Mm-hmm. Interesting. And so with adults who have, I see a lot of, you know, being in the clinical world, I think there's a certain type of personality that is attracted to medicine, dentistry, whether they are people who have high functioning anxiety or ADHD or high expectations of themselves. And certainly in the field that I'm in, I feel I'm seeing a lot of clinicians who exhibit those types of behaviors. And I wonder, is a diagnosis at that stage helpful? One of my surgical colleagues has asked me to ask you about that, because you know he's got his surgical exams coming up and he's struggling with things. Will a diagnosis help him at this stage in his life? Absolutely. So one thing to say is that it's very, very likely that the reason, or part of the reason that they are where they are, is also because of ADHD. Yeah. So it is a superpower. Yeah. So as I mentioned, you know, there are things like hyperfocus that people with ADHD often exhibit. Also, you'll find that people with ADHD have a remarkable sense of creativity. So the ADHD brain can sometimes make connections between things that other people won't. Yes. Because of the way their brains work, they'll join two dots that other people won't see as being able to be joined. So that allows them to potentially become entrepreneurs. Allows them to solve problems in new and novel ways. Combining that with a increased appetite for risk, and suddenly you have, you know, someone that has the ingredients, if it's mixed in the right way, to become very successful and be able to do a lot of things. However, the drawback with that is if there is a set of tasks that is daunting or overwhelming and maybe monotonous, like having to study for an exam, that might be where the ADHD brain might struggle. Yeah. And so getting a diagnosis to say, well, actually in this domain here, I'm really struggling. And if there's something that if I have ADHD and that's what's contributing to, you know, not everyone that can't focus on something boring has ADHD, of course. Sure. You know, that's if you're not interested in something, you're allowed to just not want to do a certain thing. So ADHD would be something that you know, kind of prevails over several domains of your life, rather than, you know, if I don't like studying for exams as a standalone thing, that doesn't indicate necessarily ADHD. It could be, but as a standalone doesn't mean it. But if it is ADHD and there's something that can help your colleague to focus, it may well be worth exploring a diagnosis. And how does one get a diagnosis? Okay. Do you mean, okay, so you as a psychiatrist, first and foremost, how do you make that diagnosis? Okay, so there are a number of tools that we use. Questionnaires, there's something called a QB test that measures, it's about a 20 to 30 minute test that with a webcam that people can do at home. And they have to, a series of shapes is put onto the screen, and the shapes come in different shapes and different colours. Right. When the shape and the colour both match on the screen, they have to hit the space bar. Okay. Sounds straightforward enough, but it's a very agonizing test for a lot of people.
Okay.
And what happens is that the webcam monitors, using facial recognition technology, monitors how much attention you're paying and how much head movement you have. How often you hit the space bar in the right way and how long it takes you is also measured.
Okay.
As well as how often you hit the space bar where nothing's happening and you just hit it because of a kind of an impulsivity to do so.
Yeah.
And so it's not a diagnostic test, but it will give you a likelihood of having ADHD type symptoms.
Sure.
And then combining that with things like a DIVA, which is a kind of semi-structured interview, and then SNAP 4 questionnaires that they give to school, to parents, which then allows you to kind of get a sense of where is this child or where is this person struggling. As an adult, you might find that it's at work and at home, and so when you have all that information, and then you interview the patient, or you interview the patient with the parents if they're a child, then you can collate all of that and you can see whether they meet the diagnostic criteria for ADHD. So it's a fairly robust way of looking at it. It's not kind of just you seem to not want to do exams, therefore ADHD. There's a fair bit that would go into a diagnosis.
How long does it take you to do? I know you've been doing that all day today, for example.
Well, the various tests and it can take a few weeks once it's started to get everything back in and collate it all and go through it. And then the interview itself with the doctors, between an hour or two to go through everything and make sure that we have the picture.
Are these tests available in the NHS?
They are. So there are ADHD clinics all around the country. However, as you alluded to earlier, with the increased awareness, that has resulted in an increase in waiting lists.
How long?
In some areas, it's up to 5 to 7 years.
Wow.
Yeah. So in some areas,
goodness.
Yeah. So the clinic I work in, one of the clinics I do ADHD assessments in, a parent came in and said, our area is nearly 6 years long, the waiting list, which means that if my child starts high school, they'll finish their GCSEs before they get the diagnosis.
And therefore they go private.
And therefore, a lot of people are electing to go to private clinics to get that diagnosis.
Gosh, that is really tough.
Because again, the importance of that diagnosis is not just the label. It is, it can be transformative in terms of that child's school experience.
Of course.
So it is understandable why people want to expedite the
100%.
assessment.
And I think, as you said, ADHD can affect societal kind of relationships and emotional regulation. And I know that we've talked about this a lot when you have seen children and have had conversations with parents asking you for help. And I think the stigma is starting to change, isn't it?
Definitely. I think over the past 10, 15 years, attitudes towards ADHD have changed, attitudes towards mental well-being, mental health, discussions around that have all changed, largely for the better. I think it's a positive.
There's so much more to talk about, but I'm conscious of time. If I might ask you for your last question, perhaps bring you back for part 2. In terms of ADHD, how often is there coexisting kind of learning difficulties or dyslexia or depression or other coexisting kind of conditions like anxiety, depression?
So there's a significant percentage of people that have comorbid conditions, whether that's autism, anxiety. Some people can have learning disabilities or difficulties. So there's a good chunk of people with ADHD that will also have comorbid conditions.
And can that be improved on with treatment?
Which?
Any?
I guess it depends. If you have anxiety, not necessarily ADHD, but improving your ADHD symptoms can improve depending on why you have anxiety and what you're anxious about. I think everything's on an individualized basis, but generally speaking, if someone is struggling with ADHD symptoms, getting a diagnosis and getting an intervention of some kind, whether that's CBT therapy for older children or adults to try and start to figure out how to manage it, whether that's parenting courses or whether that's medication or a combination of them, can be life-changing for a lot of people.
So we're out of time now, and I'll bring you back for part 2, I'm sure. But if you can help our audience to understand if they have children who they might suspect has ADHD, or if they are an adult and they suspect they might have ADHD, what would be the first port of call? What should they do?
So for children, the first port of call would be having a chat with school, getting a sense of, whether school have picked up on anything. Sometimes schools, with large classrooms don't necessarily pick up on children that aren't paying as much attention as they should, especially if there's other children that might be more unruly. So getting a sense from school would be one. And then speaking to your GP to see if a referral could go in to an ADHD service if that's something you want to pursue. Similarly for adults, speaking to your GP would always be the first point of call. Seeing how long the waiting list is in your area, and then obviously there are other options if you need them.
Private
options, yeah.
Okay, thank you so much for coming on.
No worries.
It's really helpful.
Thank you.